Yeah, I agree with everything that John said. And I would also emphasize, since this is a report back to NIOSH and our colleagues, as well as the general research community, I think this morning's session to me impressed that thinking about additional innovative research roles for NIOSH, I think is really important. I think even pre-COVID, but especially post-COVID, I think that when we heard the history about respiratory protection as it's moved over the last 100 years and then the last 50 years of NIOSH, I think there are many other groups that deserve additional hazard assessment research and innovative ways of thinking about new and different forms of PPE that can be adapted to these populations. So I think that's what John said also, and I completely agree from what I've heard this morning. I guess I would want to emphasize again that as we think of these non-traditional populations, that we're careful with the definitions, particularly since these groups may not traditionally really understand different terminologies. And if we want to get this information to the end users, meaning employers and employees, really understanding what we're talking about here. And then finally, engaging other agencies. I'm not sure, Melissa, whether we have other agencies as part of this workshop. I'm looking ahead. I don't think that we necessarily do, but we certainly heard about quite a bit this morning about OSHA and how that maps over to OSHA regulations or not for these non-traditional user groups, particularly the public. But I guess what I just want to add, thinking about that as we move forward with research and implementation.